In this week's lab, Power Lab and the force transducer will be used to measure the mechanical and electrical signals of the frog heart. You will then distinguish the different phases of a cardiac cycle from these two traces and study the cardiac functions under various conditions. To expose the heart, lift and cut away the skin on the ventral side of the frog. Lift the abdominal musculature using a forceps and cut a small opening into the abdominal cavity. Insert the blunt end of the scissors into the opening and cut upwards toward the sternum. Lift the sternum and locate the beating heart beneath it. Carefully cut away the sternum and any other tissue necessary to see the heart clearly. Remove a small piece of skin from the left thigh of your frog. This will allow you to attach the ground wire later. Cut away the skin on the right shoulder. This will allow you to pin the positive recording electrode later. To record the mechanical activity of the frog heart, a string is attached to a force transducer at one end and to a hook on the other. This hook will attach to your frog's heart. Before starting the experiment, you must calibrate the transducer using a 5-gram weight. Connect the negative electrode to the hook. This electrode comes out of the red knob. They should be tightly connected. Lift the heart up by its apex and push the hook into the wall of the ventricle. The hook must go through enough of the heart muscle that it will not tear when pulled. However, be careful to not go too deep, as you want to minimize the punctuation of the ventricular cavity. When the hook is in place, adjust the level of the transducer to lift the heart out of the thoracic cavity. The tension on the spring should be firm enough to snap back into place, but not so tight that the contractions of the heart cannot be altered. Apply a couple drops of ringers between the wire and the hook. Pin the positive recording electrode on the right shoulder. Pin the ground electrode on the left thigh with skin removed. These 3 electrodes will allow you to view the ECG of the frog heart. It is now extremely important that you squirt the heart frequently with frog ringer solution. The area with skin removed also needs to be squirted regularly. Be sure to keep all wires from touching each other or any other metal. This includes the dissecting pan, which has been covered on one edge with rubber tubing for just this reason. The hook and the negative recording wire need to maintain good connections. If the signal becomes too noisy, you may apply a drop of ringers to the point where they connect. However, be careful not to let the electrodes become immersed in ringers. These 3 electrodes will allow you to view the ECG of the frog heart. The force transducer is recording the mechanical activities such as contraction and relaxation of the frog heart. In order to understand the traces that have been produced, you will need to correlate the physical contraction of the heart to the electrical signals recorded in ECG. When an ECG is not typical, you can differentiate the atrial contractions from ventricular contractions by tapping the lab bench. Now you can identify the QRS complex from the ECG, since it occurs immediately before the tapping noise on the trace recorded by the force transducer. The other peak in the ECG trace is the P wave. After observing the normal heartbeat for several minutes, you will quantify the effects of different temperatures, ions, and both sympathetic and parasympathetic neurotransmitters. Once you are done with each experiment, remove previous solution with a transfer pipette and bathe the heart in normal room temperature ringers until the heart activities return to normal. Be sure to enter a comment with each treatment so you can interpret your data later. When examining the effects of acetylcholine, the heart might stop if the concentration is too high. If this occurs, quickly wash the heart with warm ringers. You can also apply a few drops of isoprel or massage the heart. Very often, the heart can be rescued. In the following experiment, you will use stimulating electrodes to investigate the response of the heart during different phases of a cardiac cycle. Like skeletal muscle, cardiac muscle also experiences a refractory period, determined at which point a stronger stimulus will be able to elicit a second heartbeat. During the heart block experiment, you will tighten a ligature around the heart's atrial and ventricular groove. This will alter its electrical conductivity. Gradually tighten the ligature, observe the changes in atrial and ventricular contractions, and record what you see. When you are done with all of the experiments, you will remove the heart from the frog and examine it under a dissecting microscope. Some important things to remember this week. In order to get a nice ECG signal, always maintain good connections between tissue and wires. If signals become noisy, you might want to apply a couple drops of ringers to improve the connection. If the mechanical signal looks good but the ECG signal does not, you might need to remove the ringer solution, as the electrodes may be bathed in it. This is a typical problem for the positive recording electrode, since the shoulder region often holds extra fluid. Collect all of your data before conducting any analysis. Your frog heart is dying rapidly. Please leave the hook attached to the force transducer. This will allow the next group to conduct their experiment.